Hello and welcome to today's Vaccines Europe event. Today's topic is building the European Health Union together for better public health in Europe. My name is Elaine Cruikshanks. I'm from Acumen Public Affairs and I have the pleasure of moderating today's discussion. Before we start the proceedings, just wanted to share a few housekeeping issues. So any questions that you have as the audience, and I hope you have lots, please put them in the Q&A function that you'll see at the bottom of your screen. And we'll try to get to as many as we can during the event. We've left lots of time for Q&A. Please also note that the event will be recorded, although of course only the speakers will be visible and can be heard. We have an exciting lineup with a panel which I'll introduce shortly to discuss issues around the European Health Union. And we also have to kick off proceedings our host, Portuguese S&D MEP, Sarah Cerdas, who is a shadow rapporteur, amongst other things, for the cross-border health threats file in the Environment Committee of the European Parliament. And I'll pass to her to actually make some introductory remarks in just a minute. But maybe we could just take a couple of minutes to set the scene and answer some basic issues. What is the European Health Union? Where do they come from? And why is it on the EU's table? And why does it matter, particularly for vaccines, since this is an event focused on vaccines? These are all questions that our speakers will obviously go through in a bit more detail as we open the discussion. But just a few words. The Health Union package was originally proposed by the Commission in November 2020, obviously in response to the COVID-19 pandemic, which has really changed our lives for the last 18 months, 2 years. It looks at 3 files that existed already and looks at updating them to make them more fit for purpose. One on the European Centre for Disease Control, another one on the role of the European Medicines Agency, and then a third one which was focused on cross-border health threats. These proposals are primarily aimed at making those agencies, the European Centre for Disease Control and the European Medicines Agencies, more fit for purpose in cases of pandemics. And so we all saw during the last 18 months how effectively the vaccines industry, amongst other people, rose to the challenge and worked very effectively with those agencies to actually get to us some vaccines which we are all benefiting from today. I like you, I hope, benefit from having 2 vaccines and can therefore be back in the office at least part-time. But no doubt there's more learnings that we can have from the experience that we've all been through. So really some of the key questions that we'll aim to answer during this will be, what are the lessons from COVID-19 and how can the EU improve in public health and vaccination? And then secondly, how can we make those agencies, the Ecdc and the EMA, better equipped to effectively respond to cross-border health threats? In terms of the process, this is a very timely webinar because we actually have the EMA file already in trilogues between the co-legislators, and we have a major vote due for the plenary next week in the European Parliament on both the Ecdc file and the cross-border health threats file. So I'm just checking my colleagues. Ms. Cerdas is not here already, so when she arrives, we'll introduce her and let her make her remarks. But in the meantime, I'd like to introduce our panel for today. So they're going to switch their cameras on and unmute themselves. So there we have Isabel Becker-Edgen-Ding, who's head of microbiology division at the Paul Ehrlich Institute from Germany. And then also on the screen, Marco Cavalieri, who's the head of biological health threats and vaccine strategy at the European Medicines Agency. And then Richard Price, who's the head of policy at the European Cancer Organization. And last but not least, Sibylla Kilici, who's the executive director of the co-organizers here at Vaccines Europe. So perhaps, Sibylla, I can start by asking you an opening question. Why you think the European Health Union package is so important for public health in Europe, and particularly for vaccines, given your role.
Thank you, Elaine. Thank you, and thank you to So hopefully MEP Cerdas will join us, and to the panelists who joined today's discussion on the EU Health Union package. Indeed, it's an important initiative for Vaccines Europe, but in fact for immunization more generally, because it's a long-awaited opportunity and an important step forward to strengthen immunization policies in Europe. I think infectious diseases are a permanent potential threat, even when you have vaccines available. Today, routinely, we can prevent against 20 infectious diseases, but access to the relevant vaccines varies significantly across Europe. Pandemics and outbreaks are constant risk. And not so long ago, just before COVID-19, the measles outbreak led to 100,000 cases about, in rough estimates, and 100 deaths. And this is just to underline my main point that, yes, we need strong agencies with adequate resources and tools working hand in hand with member states to tackle infectious diseases that, as we know, have no borders. And because of the vaccine industry plays a critical role in pandemic preparedness, we've seen it with COVID-19, but beyond pandemic as well, an important role in terms of response, but also with regards to post-marketing studies in general. We need to ensure that our agencies are empowered to have close, continuous dialogue and collaboration with industry in order to prepare in advance, react fast, and respond better. So this is really critical for to tackle infectious disease in Europe.
Thank you. Just picking up on that, Isabel, from a national perspective, I'm sure you agree about the point about collaboration. How do you view the lessons learned, or how do you view the European Health Union package as helping national regulators and national agencies in their work of actually dealing with infectious diseases and pandemic in particular?
Yeah, probably the most important lesson learned in the pandemic is actually that we need to communicate, that we need to have established communication channels, and that COVID-19 did not stop at any borders. And thus, I think that it really makes sense to build up a better network in the EU and to use actually the bodies that we have and exploit their potential to try to secure our health and to secure also our travel within the EU. And additionally, I think COVID-19 was an important trigger to remind us of the stability of the supply chains, for example, and how important it might be to have manufacturing in the EU. And I think that with these triggers, the EU Health Union has become a new dimension that we can actually try to establish and made it very much more concrete than it used to be. Great.
And maybe turning to you, Marco, from the perspective of having lived through this pandemic with all its challenges in the European Medicines Agency, what is it that you think from the inside out that the European Health Union package is going to deliver to your agency and to agencies in general, like the Ecdc as well?
Oh yeah, indeed, there are very important elements that are contained in this package. And with respect to DMA, I think the strengthening of the mandate of the agency with respect to a good analysis of what is happening for shortage of medicines across Europe and beyond is an important one. And of course, from my perspective, being heavily involved with the EMA task force, also the fact that this is embedded into the legislation as an important tool to have a platform that has agility, can interact rapidly with developers, and can come up with also recommendations behind what the committees can usually do, because as you know, the system is pretty rigid from that perspective. So we need to have really the possibility of a way of engaging more rapidly, of engaging not only with developers, but with stakeholders in general, including healthcare professionals, patients, response to queries from the public, and also interacting with our sister agency, the Ecdc. And last but not least, of course, the international domain and the interaction with the international regulators behind Europe, which is also so important. And I think also with the ICMRA, we strengthen this. So this is really important and is contained in the package. I have to admit that what I'm missing is the part on preparedness, because let's not forget that it's not just about response, but it's also about preparedness. The more we are prepared, the more we have vaccines authorized before the actual outbreak or even therapeutics, the better it's going to be and the easier it's going to be. So the work of the EMA will not be focused only on the response, but also on the preparedness. And with this, we have to work with all the stakeholders, similarly to what we've done for the response.
Great, thank you. And Richard, if I can then turn to you, obviously, it's been a torrid time, I think, for cancer sufferers, the pandemic. But what is it the European Health Union can deliver for cancer patients or preventing cancer, in your view?
I think it's a fundamental reworking of the infrastructure when it comes to what the EU does on health, and really changing the message that I think 2 years ago, we would have been worrying that the EU didn't even think health was something that it needed to be very concerned with. I think hopefully that has changed forever now. So I think the Health Union package is a very important part of establishing that, in fact. And I think in terms of looking at our interest, particularly perhaps in this discussion today around things like HPV cancer elimination, what we've been able to see achieved by agencies like Ecdc shows what that cooperation role can achieve in terms of tracking where we are with vaccine uptake. And I think if we could see that approach shared to other disease elimination agendas, there may be some good that can come out of this torrid time that I think the whole health service across Europe has experienced.
Great. I mean, maybe I can go back on one of Marco's points about pandemic preparedness and response, and he sort of raised the issue of what we're missing in the proposals. But what is it you would hope to see that from the lessons learned perspective in the package that could actually fill the gaps, as it were, from things that didn't go entirely well during COVID-19?
I think indeed there are important aspects on the response that are covered there, including the tricky one on the clinical trials. You know, we have situations when multi-country clinical trials have been run during the pandemic that they were not approved as fast as we would have hoped for. But what I think is missing is to say how we're going to strengthen the role of the EMA also in peacetime, so before the actual outbreaks, because we need to be prepared. You know, we cannot set up the ETF all of a sudden and to have, you know, firemen ready to start their work when the fire is out. They need to be prepared, and we need to have in place system that could allow the EMA to be prepared even before the outbreak, and even doing regulatory work before the outbreak. The more we advance countermeasure before the outbreak, the better it's going to be, because we will be faster. And this requires a lot of work that we started doing together with the WHO and other agencies in the United States. And I think we should continue to do that, but that is not covered in the package.
Maybe we can come back on that once we've heard from MEP Sardas, who has now joined us. Welcome, and thank you for co-hosting this event. MEP Sardas, could I just turn to you to make some introductory remarks? We've already, as you can hear, plunged into the discussion, but we'd love to hear from you, and thank you again for making time to be with us this afternoon.
Hello, good afternoon. I'm very sorry. I hope the European Health Union is not as hard as entering in this meeting, because it was quite a challenge. But I'm really happy to be here, and I would like to start by thanking Vaccines Europe for the opportunity to be here and to be able to share some of my thoughts on you with you. I've heard Mr. Marco Cavalleri stating some part that I also wanted to convey to you. So I think we might all be on the same line. It's very important and the time is now to discuss the European Health Union, to move over, as we have the different pieces of legislation happening at the moment, meaning the negotiations. And this is important because the importance of these events is to create this discussion where everyone plays a role, and including on initiatives like this, where we can exchange ideas and actually contribute to the parts of the negotiations that are ongoing in order for us to have meaningful policy solutions. I was one of the negotiators for the EU for Health program. I'm very happy to say that we had the opportunity to put health promotion and disease prevention as one of the main goals. And it's important to relate these two issues for the outcomes of health for European citizens. As we know here in this group, we're talking on an event on Vaccines Europe. So I believe most of us already know that one of the greatest achievements of humanity on one of the most cost-effective public health measures on disease prevention has been through vaccination. For that, we need secure and efficient vaccines, but also we need to involve the population. And this is important to invest in health literacy in order for the citizens to be more equipped to have the best tools in order to fight vaccine hesitancy, as we have seen, for instance, with the latest developments on the COVID-19 vaccine. And we need to work together with everyone involved in order to achieve good results and increase the vaccination coverage across the whole European Union. And as we see it now, for instance, and it has been for many vaccine preventable diseases, is that vaccination rates differ greatly among EU countries. And I know that because I'm also a medical doctor in the field of public health. I've been working in this field for some few years. And I come from a country where we have a great vaccine coverage, but it's due to our cultural history. Whereas 4 decades ago, people didn't have access to healthcare services, and a lot of people died from vaccine preventable diseases. So moving on, we also have that the COVID-19 pandemic uncovered many of the gaps, many of the difficulties that our health systems have, and that we must address at the EU level, but also at the national level. And one of the main lessons learned is how effective and quick immunization campaigns that were done for COVID-19 could be drawn to other vaccine preventable diseases. And out of my head, I'm thinking about HPV vaccination, for instance, now in our youth. One of our commitments, being a member of the European Parliament, is to deliver solutions to better equip the health systems to face future crises. And these challenges cannot be faced by countries alone, as we've seen at the beginning of this pandemic. So I would just like to highlight several points of the legislation that we are working now at the Parliament. And just give you a brief tour on that. First and foremost is the cross-border health threat regulation. I'm one of the negotiators, and this piece of legislation states that we need EU-wide programs to ensure proper coordination between member states and the EU, not only in times of crisis. This will be in order to avoid future crises or to mitigate future crises. This is very important, and to actually have and think on a European response mechanism against future health threats. This is tangled with the increase of competencies for EMA and Ecdc. These are the cornerstones for the European Health Union package. And for EMA, we have some proposals to prevent disruptions in the supply chain system in order to have a database to understand how are the different supply levels of medicines all across the supply chain, and to have a task force in order to prepare us for future crises. And EMA also plays an important role on reassuring citizens of the safety of vaccines. During the pandemic, when I don't know if you recall, the US and the UK had approved the COVID vaccine before EMA, and a lot of journalists were asking me, why is the EU delaying? And my answer as a medical doctor mainly would be that it's good that the EMA is taking its time. It means it's going properly through all the scientific process, and it's this assurance that needs to be portrayed to the individuals. And also, finally, the increase of competences of the Ecdc to have a stronger role communicating to the public, and also to strengthen its capacities to have better management and preparedness and more tools for the next health crisis. We've seen that the ECDC was a bit strangled when trying to deal with COVID-19. So I don't want to go much further beyond that. I think I already reached my 5 minutes. I would like to wish for a very fruitful dialogue. I'm sure many ideas will come up, and I'm pretty sure that European Union, we need to ensure has the adequate tools and instruments to be prepared for a wide range of present and future crises. Present crisis is not only COVID-19. As you know, we have several other crises. One of the most emergent is the antimicrobial resistance, for instance. So I would like to give back the floor to the moderator to hear from the speakers. And thank you again for inviting me.
Thank you. I don't want to keep you, but just one follow-up question that others might join in is, do you think the Health Union package has managed to get the balance between the EU competencies and strengthening them, as you say, sufficiently? Or do you think the member states are pushing back too much in terms of keeping national competencies?
I believe that we managed to have a good balance on that, because we understand that the protection of public health is a shared competence between the EU and member states. And I believe that member states already realized that during this COVID-19 pandemic. This was a terrible thing that happened to all of us, but there's so many important lessons to be learned in order for us not to repeat the same mistakes when dealing with the worst public health crisis from the last 100 years. So I'm very hopeful on this legislative package, and I really much look forward to see what it's going to reach on at the end.
Thank you so much, MP Cerdas, for sparing the time to be with us this afternoon. And I
My
know
pleasure.
we'll follow up in terms of keeping you abreast of our discussions and the outcomes. Thank you very much indeed. Have a very good afternoon. Maybe I can turn back to the panelists now, and further to what MEP Cerdas has been saying. Do you think, Isabel, that the balance is right between national competencies and EU competencies? What we've seen in the Council, but also in the Parliament, is that proposals from the Commission have been somewhat weakened, or weakened depending on your point of view, but have been somewhat pushed back in view of the undoubted member state competence that we all know in health. Is that something you welcome, or is it something you think we need to build on?
It's something I'm not really worried about, because I think this is a process. It's a process of building trust. It's a process of understanding how to really organize and how to translate the lessons learned from COVID-19. I think we have things that are better to do on a European level, like procurement, where I think it's much easier to argue that we need this. And there's other things to do, like deployment of vaccines, where we have to know the regional peculiarities of every different member state, and we need to understand how to get into the last village. And so these are more the operative tasks. And I think if we really look at all the things that are to be done and all the tasks we face in a pandemic, you will see that there is some that are really benefiting from a central organization, and others where we will need people feeling responsible for this on the regional level. And so I think that these two functions do not exclude themselves. They should actually work together, and the synergy will actually be the solution for the EU.
Right. I don't know if from an industry point of view, Sibylla, do you think the balance is right? Or is there something to build on that we're moving forward with the European Health Union package in terms of that strengthening of the centre?
I will definitely support what Isabel just said with regards to respecting the national competencies and building trust. I think it's really about building trust, providing also the right tools in order to collect in a harmonized way the information, the data to be worked out in a pan-European way, and to feedback actually the member states, but also the Council of the European Union in order to have the necessary measures to slow down the spread of infections, or actually to anticipate potential health threats. So from an industry perspective, we really hope that this trust building will take place, is taking place, and we're seeing with COVID-19, and that we can have this good cooperation between the EU agencies and the member states.
Right. So Marco Cavalieri, so one of the things that have been proposed for the EMEA is the Emergency Task Force and also the Medicine Steering Committee. Do they stem out of the experience of COVID-19, and how can they help us going forward?
Yeah, I think the legislative proposal builds on what we have been doing during this pandemic. So the ETF has been active since the first day of the pandemic. Actually was activated even before, because was stemming from our health threat plan that we had already in place since a while, because there were many emergencies already coming up after the influenza pandemic in 2009. So we were really concerned about this, and we felt it was good to be better prepared and to have a structure to handle these emergencies. So the ETF was there, and the work on the supply was already ongoing with all the member states, so with all the national agencies in the member state, which is essential in order to collect good information about the availability of medicines across Europe. So essentially, I think what is nice to see is that the work that we have been doing has been transformed into legislation, which means that it was appreciated as a good way forward. Of course, you know, there are other things that we might like to see into that, but we understand it's important that these move on further rather rapidly, and we get to the point that we have in place a legislation that would allow these activities to continue in the best way possible. And as I mentioned before, also the one on the clinical trials is an important one, which is not easy, because clinical trial approval is competence of the member states, is not EMA competence. But in a crisis like this one, it turned out that even the systems that were in place were not sufficiently good in order to come out with a pan-European opinion on authorization of clinical trials. So it's obvious that we have to do better, and the ETF could be the right place for having a discussion all together with the member states and the expert from the EMA in order to come up with a way forward that could allow a faster put in place of these clinical trials.
Great, thank you. Maybe I can move on to Richard. You know, the experience in terms of a stakeholder, what is it you would hope to get out of the agencies that would help you in your campaigns to help patients?
Sure. Well, I think as we think to future health emergencies and planning and preparedness, I think trying to systematically collect the experiences of stakeholders, be they patients or healthcare professionals, what they saw on the ground is very important. Work that we've done has really shown, for example, some of those workforce impacts of stress and burnout during the height of the pandemic, but also the workforce shortages that we need also to have covered in our health emergency planning. But I also think there's some very good models of stakeholder engagement and involvement from other agencies that could be transferable. And I think in that respect to the European Medicines Agency, who've a long history there of setting up good systems to involve all of the stakeholders in so much of their decision making. And if that could be transferred as we think about the future European Centre for Disease Prevention and Control, if that model could be adopted there, I think that would be of great benefit in making sure that our preparedness planning is the best informed as it can possibly be.
Right. Isabel, on the issue of post-marketing monitoring and of safety. We've seen a good cooperation during the pandemic between the EMA and the ECDC on this, on COVID-19 vaccines. Is this something that could be used across the board in vaccines more effectively?
I am very sure about this, yes, because I think ECDC has so far not really gained the significance or relevance in the EU that it could have. And I think in this pandemic, we saw that this role might be very relevant and that ECDC could be a very important focal point for collecting data, for actually building up networks to the member states and their public health agencies, and to actually drive the dialogue to understand, you know, what kind of vaccines do you need, where do you need to deploy vaccines, where is the clinical need highest, and so on. And maybe if you allow, I would like to also confirm what Richard said. I also agree that we should not narrow the lessons learned from COVID-19 down to pandemic preparedness. And that I really think we learned that flexibility is needed, that we need to strategically think about how we can be most agile and efficient on the EU level, and that there might be important operative and communication channels that we need to really establish and prepare for something unknown, because still, you know, we did okay, I think, in this pandemic, and I think there's many things that went very well. There's others that didn't go that well, and we should make use of the situation for the future and not restrict it to infectious disease.
Great, that's a very good point. And Sibylle, just building on that, I started off by talking about the post-marketing studies, but I think what we got into was the need to basically pool expertise. I mean, in your view on that particular point of post-marketing studies, what you're hoping for to come out of the package that will help things move forward?
So you mentioned expertise. It's important to mention that the expertise in vaccines, the network of this expertise in vaccines in Europe is limited. So indeed, everybody pulling the expertise to one each other is potentially an issue, and we need to be really mindful of that in that regard. With regards to post-marketing studies specifically, I think it's really important to understand that sort of post-marketing studies that we call also phase 4 studies that are real-life effectiveness and safety studies once the vaccines are on the market. It's important to know that the vaccines developers have the obligation to run those studies for EMA, and this is completely integrated in their risk management plans. And cooperation here would mean to be in the positions to meet better the public health goals of these studies by sharing expertise, protocols, but also avoid unnecessary duplication of resources that could potentially undermine the quality of these important studies. So collaboration here would be key for pandemics, but not only, and for all the vaccines that could fall into this.
And we hear a lot, Marco, about the data revolution, the health data space. Data is the new gold, as it were. How do you see the agency already leveraging data more effectively? Things like real-world evidence obviously has become very current on the COVID side of things. Is that something that is going to be built more into the way you operate on pandemic and non-pandemic?
No, yeah, absolutely. I think this is just a starting point, and indeed the idea of the platform for monitoring vaccines performance post-approval, we are starting from COVID for obvious reason, but the concept is to expand this to all vaccines. So we would like to really have a strong infrastructure across Europe that could conduct large observational studies looking into any specific safety issue or looking into effectiveness of all the vaccines that we have. And we know that we need to go broad. Data from a single country or region might not be enough in order to have sufficient power and to mitigate the potential biases. So it's important to have very large data set that cover different countries. And that's what we will be trying to do with Ecdc. And of course, I take the point from Sibylle of having dialogue continuously with industry as well. But the idea is to have, these as an independent panel made up by public health authorities, regulatory authorities on one side, and public health authorities on the others, that is working really for building something that can be sustained over time and can deliver data that are so important for European citizens in order to convince them that, first of all, we are tracking very carefully what is happening with vaccines, and to show them the benefit of vaccination, not only for COVID, but also for the others.
Mm-hmm. So on that point of confidence and communication, I mean, is there more? I mean, ECDC is supposed to have a strengthened mandate to communicate more with the public on public health issues. We've seen, though, across the pandemic, one of the issues has been mixed messages, if I can call that. Take the booster vaccines, where you've had ECDC come out and say, and as of other regulatory authorities in the US and the UK, there's no need for these at this time. And then you have governments who are busily pushing ahead with booster vaccine programs. Does that lead to confusion amongst the citizen? How could we get to a more of a one voice situation? Any views on that, Isabel?
Yeah, definitely. This makes it very difficult. And I think another learning from COVID-19 is that basically experts are not confined to the public or the private sector, but that there is, or the European level or the national level, but that we actually need all these experts to participate. But what we should find is a better communication process, a better network, and how to exchange, how to maybe really communicate less in some instances and more in others, meaning that you need a communication plan, which makes it easier for the public to understand where information comes from, which information is trustful, and to actually see the significance of this dialogue. And I think that could be also a goal for the future, to establish a dialogue between the private and the public sector.
Great. Richard, as a sort of citizens representative here, from the patient point of view, how would you like to see things dealt with in terms of the messaging that's come out during the pandemic? The example I gave, for instance.
Well, I think the communications aspect is enormous, and particularly now when we face the challenges we have with vaccine hesitancy, I think that part of what the ECDC and EU agencies can do has perhaps been underappreciated. And I think at the moment, if we look to internationally, like the CDC in the US, there's some fantastic materials that they are producing to provide improved information to the public, to challenge, rebut other information that might be being put out there. And I think when we look to see what are we trying to build in the future, that communication role of ECDC needs to not be just a bit part of what they do, but a very big part of their role.
And Sibylle, do you have a point of view from an industry point of view on that?
I think it's related to what everybody said and what you bring with regards to this notion of one voice. I think it's really critical. There is clearly a low awareness among the public, the healthcare professionals, about the existence of ECDC. Obviously, the pandemic brings more, definitely brought more light to existence of and the role of the European Medicine Agency and the ECDC. But honestly, having had in my previous professional experience, life experience, connections with healthcare providers, they didn't just know about those agencies before. So there is definitely need for awareness about the roles, the responsibilities, the value of those agencies, and the member states. I mean, they have a critical role here to play, because a lot of the information that they have, they are using, sharing. I mean, there is collaboration happening with the CDC and EMA. So transparency in terms of communication, how this collaboration takes place, and also when the data are used, when the information are used, which is the sources, is critical, so that also the citizens know where to, which sources to trust, and when they are actually have communication from the CDC or EMA, they know that they are the reliable sources to look after.
Yeah. I hesitate to ask you, Marco, but I'm sure you have a point of view on this.
Oh yeah, this is a very important aspect, and I have to say that I've been exposed to interaction with the media to an unprecedented level in my career. And but you know, I really saw how, you know, difficult it is, because people they do not understand why a recommendation from the EMA should be different than one from the Ecdc, or different from what is decided at the member states, and all plays against each other to try to challenge whatever is decided. So clearly there is a call here, first of all, to work more with the public health side. So that's why working with the CDC, but also with the NITAS, because, you know, differently than other region here, we have to multiply everything per 27. And it's very complicated. And sometimes, you know, we don't know really what to say, because whatever we say may go against whatever a member state has decided to do. So this is really a difficult area, but definitely something that we have to work on. I do believe that the work that we had initiated with the NITACs and with DCDs is an important one, and we should strengthen that. We should carry on continuous dialogue with them. The more the public health side talk to the regulators, the better it's going to be, because the more chances for convergence will be there. And when convergence is not possible, then we have to think how to face it from a communication perspective, because, you know, telling European citizens the difference between what is the regulatory role versus the public health role, I'm not sure if this is something that is accepted even from the public at large. So we need to work on that.
Yeah, I think the recognition of the source and the credibility of the sources is something we all grapple with in this age of social media. So yeah, I think we all agree on that. I'm now going to turn to some questions from the audience. So you can all see them, hopefully, the panel. There's one that I'm looking at on post-marketing studies, which I think we've dealt with. So I'm going to move on to a question that's come up about the role of the European Health Union in terms of maximizing the underlying health stock of populations. COVID was the stimulus of our current major health crisis, but the systemic underlying health conditions, for example, on chronic diseases, NCDs, etc., and the independent risk factor of aging populations, which are likely to be modifiers in any future health stock, which may not be infectious diseases, but maybe a stimulus for health problems. Do the panelists think the EU Health Union should include a stronger role for the EU in this area? So I think what they're getting at is that we're really focused on infectious diseases. Should we be also focused on NCDs through the agencies? Any views on that, Marco?
No, yeah, of course, the question has already emerged in several fora around what the lesson learned from this pandemic can be used also for other therapeutic areas and in other settings. And I'm sure there will be a lot to be looked at that could be really important to do. So yeah, probably something that is worth, you know, really understanding what else can be done also within the European health package around other therapeutic areas. And maybe there are some important aspects that could also be translated into that kind of setting. Of course, I'm dealing mainly with infectious diseases, so for me, it's important anyway not to dilute too much the concept here. It turned out for once that infectious diseases were really driving the public health agenda with this pandemic in an unprecedented way, and we should not forget this lesson. So for me, it's still important that, yes, let's look at the others, but let's also build something important and sustainable and helpful for the future in this area.
I expect, Richard, you've got a point of view on that.
Yeah, I think we have happening at the same time the publication of the Beating Cancer Plan in February, which had a range of very admirable goals around improving the general health of the EU citizens, and that all those things need to happen. Front of pack nutritional labeling, a tobacco-free generation, combating marketing of alcohol. Those things need to occur, but I think we'll probably also need to have a conversation around there's linkages between disease conditions. So obesity and COVID, of course, has been noted. Obesity and cancer is another well-established link. We need to look not only at prevention, but how can we treat obesity? How can we treat those conditions so that we recognize much more their interrelationship and the comorbidities between conditions. So I think that's one area still to be developed and worked on further when we think about the Beating Cancer Plan and the Health Union.
Great. Can I move to another question? So with regards to the COVID-19 vaccines post-authorization studies, is there any update on the EMA Ecdc platform for vaccine effectiveness across Europe? Any information on timelines, countries involved with this platform, and also assess influenza vaccine effectiveness in the coming influenza season? Isabel, do you have any information on that, or Marco, I suppose?
I'll leave it to you, Marco.
Yeah, I mean, the effectiveness studies from ECDCs are ongoing. So we look forward receiving the data from their effort. From an EMA side, we already started doing safety study, and you've seen also this summer there was a publication from large studies on thromboembolism risk after vaccination with different type of vaccines, which is the first example of the kind of studies that can be delivered throughout this platform and the type of tenders that we are putting in place. So I'm sure that there will be more to come. And of course, here we have been rushing into setting up something because of the pandemic. So we started doing what we could in the time frame and with the resources available. But the aim is to expand this. And indeed also influenza, which can be easily linked as another respiratory virus to the activities on COVID, might be the next one. And then we will see for other pathogens. And as indeed I said before, the aim will be to enlarge this platform to cover all vaccines for preventable diseases.
Okay, thank you. So another question from Valérie L'Aigle. Not having regular and publicly available vaccine coverage rate data per country and vaccines available is a barrier to monitor proper implementation of vaccination programs at EU level and further document heterogeneity of implementation amongst EU countries. What can be done by the EU in this field?
Actually, I think that a lot can be done, because also with COVID, we learned that certain populations are at risk, the demographics are important, comorbidities are important, as Richard just explained. And it was also not easy to make data-driven decisions because the data available were limited. And so I think that one thing we could really do is establish systems to generate these data and to facilitate this. And this would in the end also help to understand who needs to be vaccinated, for whom there is protection needed because the vaccine won't work, what side effects are being expected, why we need an array of different vaccines to make the right vaccine available, and sort of an individualized vaccination scheme for people, and many other questions. And I think this can only be done on a European level, because you're only going to get this amount of data at the European level.
Sibylle, anything to add on that?
Yes, I think I will go back to what we mentioned with what we've seen happening in the context of COVID-19 with the CDC. Richard mentioned it with regards to the COVID-19 tracker from the CDC that provides on a weekly basis today information in terms of epidemiology, but also with regards to the uptake of COVID-19 vaccines for all member states. And indeed, this would be critical to have for not only for pandemics, but for routine vaccines in general, because this will contribute to build resilient health systems in order to react fast if we see any decline in those coverage rates. I have to say that the immunization systems are far from being resilient today. The COVID-19 pandemics have actually impacted tremendously the performance of those programs with the lockdown, obviously, all those distancial measures happening, but those programs for many member states were suspended. So for many vaccines, vaccination, pediatrics, adolescents and adults today, not related to COVID-19, we have actually lost track on the coverage rates. We don't know where we are at, just we see that there is a decline in appointments for getting vaccinated by the different part of the population. And we are all frightened about the impact of that, from a risk of outbreaks, whether it is of measles or pertussis, for example. We know that it is a difficult. HPV vaccination, for instance, has been a difficult one to implement and to have a nice uptake in the countries implementing the programs. And here we have lost track actually of the synergies that was initially created, and it's going to take time to go back to it. And with regards to the impact that all of this COVID-19 is going also to have on influenza for the next seasons, for example, we don't have today the tools that are going to provide information on where we're at with the implementation of the influenza vaccination for the next seasons. So indeed, we've seen that it is possible. The collaboration of the member states obviously is critical here to support the Ecdc in delivering the data, but we know it's feasible, so it should be expanded to all vaccines today.
Thank you for that. Isabel, I know you have to leave. So just before you do have to leave, I'm going to turn to you. And Richard, I saw you want to come in later, but perhaps we can go back. Isabel has to leave, so it would be great just to have your closing remarks. If there's one thing you wanted to leave as a message about the European Health Union package and what we can do with that going forward, what would it be?
Yes, that I think we should think more strategically, and we need to really understand the reasons for having different assessments, whether that is between EMA and ECDC or the member states and EMA. I think we should all have clarity of why certain decisions are being made and understand whether this discrepancy is really necessary. And so sometimes maybe halt, think and reflect before we actually go into action.
Great. Well, thank you so much for taking part, and we hope to catch up with you again very soon. Thanks again. Have a very good day.
Thank you for having me. Bye-bye.
So Richard, you were burning to come in, I think, on that point about vaccine coverage rate.
Yeah, I think, I mean, a very good question. And thinking of that conversation that we had about competencies and some of the difficulties, I think collection of data, publication of data, surely member states cannot be so vociferous against that sort of role for the EU. That coordination and transparency provision, I think, is, we hope, uncontroversial. I think it's also important when we think about the data that we need, trying to connect lots of EU initiatives in the data area that are taking place, be that the health data space or in our own area of HPV cancer elimination. We're looking at the cancer inequalities registry that's being developed. Can that shine some further light on which groups are receiving the vaccine in less numbers or more numbers? And I think all of that, you can tie that together by establishing these EU goals. So this, now that we have a EU goal for HPV cancer elimination, I think that's a very important test case for, can the EU, through its tools, agencies and role, achieve disease elimination, and can it tie together all of the pieces that it does? So I think, yeah, data is such a key fundamental part of driving that forward.
Thank you for bringing that point back to us. Thank you. So we're coming to a close. I just wanted to give all of you a chance again, as I did with Isabel, to leave us with your top recommendation, as it were, in terms of how the Health Union package is going to help us go forward as citizens, but also from your point of view in your particular line of work, be it the agency, be it as an industry or as a stakeholder. So maybe I can turn to you, Marco. What do you want to leave us with as the things that we really need to do better going forward?
No, I think indeed the health package is a good starting point, but first we need to put in practice and we have to be ready to adjust as needed. There are a few areas that are not being tackled yet, such as having an emergency use authorization in the European Union at the central level, which is still missing, just to give an example. But also indeed not forgetting that we need, in order to be better prepared, we need to do a lot of work when the outbreak is not out, when the crisis is not yet on. And so we should not forget about this, and we should work all together in order to adjust what is in this package in order to make this happen. And also I look forward seeing from the HERA body what is going to come up and what will be its role. And of course, we as EMA, we stand ready to collaborate with them. And indeed, strengthened collaboration within the European institution is needed, but also with the member states, we should really work together. And I think one area that we're doing well, which is the international collaboration, should be maintained as well. So a world that is more connected and ready to take decisions together.
Thank you for bringing the global health aspect into it, because there's been some questions on that about the need to cooperate as well, which I didn't get to. So thank you for bringing that in. And can I turn to you, Richard, if there's anything else you just want to leave with us from your point of view in the cancer organization as a stakeholder? What is it you really want the European Health Union package to deliver? Data, obviously. Anything else? Yeah,
I think I'd just like to chime in with Marco's comment, a good starting point, but this pandemic isn't over yet and we're still learning lessons. And so my final comment would be, I think we shouldn't see this package as a one shot. I think we maybe need to come back again in 12 to 18 months to look at what else do the EMA, ECDC and others need in terms of a toolkit, in terms of mandate, in terms of authority. So to keep this as an open discussion.
Great, thank you. And Sibylla, what is it you want to leave us with as your key thoughts?
I will give 2 points, one as an industry and one as a citizens, because I think with all these vaccines, infectious disease context, we're also citizens behind our screens. Coordinated and inclusive multi-stakeholder engagement at national, regional and global level, I think is critical to tackle the public health threats. And I think we've been quite aligned during the panel today in that regard. And as citizens, I really hope that we need to have a one voice approach to avoid confusions among the citizens and really ensure adherence of the citizens to those key public health measures.
Thank you very much. So with that, I'd like to sort of just close proceedings. I'd like to thank all the panelists who you see in front of you, also Isabel, as well as our host MEP, Sarah Thardes, from as well as Vaccine Europe as the organizers. I've certainly enjoyed the discussion and I hope you found it informative. Sorry for not getting to all the audience questions, but we will look at those, and I'm sure there'll be ways of communicating on that, not least of which is the podcast series which Vaccines Europe and FBA have going. And there you can catch up with a podcast with other speakers, including speakers here, hopefully, on the Health Union package and other issues around vaccine. So with that, I'd like to thank everybody once again, and most of all you for participating, and wish you a very good rest of day. Keep safe.
Thank you.